All right, so we're going to continue on with chapter 1, where we're going to focus in here in this section on cancer, or what we call neoplasia. Neoplasia is new growth. This is proliferation and differentiation of cells. Now, what happens with this a lot of times is that they are proliferating too quickly. This creates a tumor. Or they also, when they are proliferating, are not becoming differentiated, and so because of that, they're no longer functioning like the original organ they came from. So this is an abnormal type of cell growth, and again, it does get termed as a tumor. A malignant neoplasm is what we call cancer. Benign growths, however, are generally easily cured, and they are not termed as cancer. Malignant cancer may not be survivable, and cancer is associated with altered expression in your cellular genes. Carcinogenesis is the process or formation of cancer, and this takes place in 3 main steps. The first is called initiation. Initiation is when there has been damage to the DNA, which causes a mutation to occur. Mutation is any change. Depending on the amount of changes, causes it to go into then promotion. Promotion is the proliferation, and it's the growth of promoters, which continues to have those cells divide more uncontrollably, creating again the beginning of that tumor. If that tumor starts to progress and starts invading other areas, this is going to be where we see progression. This is the development of the cancerous phenotype, which means that we're going into that malignant type of characteristic. Cancer is the second leading cause of death in the United States. It's only beaten out by heart disease right now at the moment. Most cancer deaths occur in individuals that are over the age of 55. Men have a 1 in 2 chance of developing cancer, and women have a 1 in 3 chance of developing cancer. 1/3 of cancer-related deaths may be attributed to their lifestyle. And some of these lifestyle factors we actually do have control over, whereas others we may not completely have control over. So one thing we're looking at here, the first one is like tobacco use. Tobacco use increases your risk for cancer greatly. The reason why this is such a big deal is that tobacco or cigarettes contain 2 types of carcinogens, which means they contain what we call a initiator, which can change your genetics to start with, and they also have chemicals that can act as promoters, which can promote the growth of the cancer. Now, tobacco is not just related to lung cancer. However, when we look at relation to lung cancer has dramatically increased, and this could be due to smoking. We also see that it's the leading cause of death in men and women, and it has the worst survival rate in the cancer field. We also see, though, that tobacco does not just cause lung cancer. It can cause pancreatic cancer, kidney cancer, bladder cancer, mouth and esophageal cancer, as well as cervical cancer. Also, being around secondhand smoke can increase your risk as well. The next thing we'll look at is nutrition. When we're talking about nutrition, there are some dietary factors that are believed to be related to cancer. Some of these include things like fat. Increased fat content could potentially increase your risk for cancer. This creates kind of a problem when you're looking at certain kinds of diets like keto, where they're having you take and consume large amounts of fat. It could potentially, I'm not saying it will, but it could potentially put you at a higher risk. Another factor for nutrition is decreased fiber. If you have a decreased fiber in your diet, it causes your bowels to not move as well, and so because of that, waste products are staying in your system longer, and that puts, again, at a higher risk. Increased alcohol intake also puts you at a higher risk for many types of cancers. And also antioxidants. With antioxidants, if you are not taking in enough antioxidants, it could potentially cause problems, because antioxidants help us be able to neutralize free radicals, and free radicals actually cause damage to our cells and can damage our DNA. And so making sure that you're taking in enough antioxidants, which are found a lot of times in your fruits and vegetables, are going to be helpful in making sure you could reduce your risk. Another thing when we look at nutrition is also obesity. If you are overweight, again, you are increasing your risk. Does not mean that you definitely will get cancer, but it does increase the risk. Sun exposure increases your risk greatly for skin cancer. And then sexual exposure to HPV increases the risk for cervical cancer. Early screening aids are really important when we're talking about cancer, because if we get early detection, it's going to allow for a greater prognosis and potentially a better outcomes after treatment. All right, so I have a quick question here before we move into actual things that potentially can cause cancer in us. But what is the major factor leading to increased occurrence of cancer in the elderly? This is really important because when we're talking about this with elderly, there's a lot of factors that can come into play. But when we look out of these choices, it's actually A is going to be the best choice. The reason is the older you get, the more you've been exposed to carcinogens. And so because of that, it's kind of like it's an impact of 55 or 60 years of stuff that's on your body versus if you're only 10 years old, you've only been exposed to 10 years of these potential factors. And so when we look here, A is going to be the best answer in a question like this. So there is a genetic mechanism that is related to cancer. A carcinogen is anything that can potentially cause cancer. So we know what some of these are, like why cigarettes do have that warning label on their container, because they are linked to causing certain kinds of cancers. But when we look at this, we don't know everything that potentially could cause cancer. And so with that in mind, we may find in the next 5-10 years that there are things that we've been exposing ourselves to that could be considered a carcinogen. We also see that in our genetics, there are what we call proto-oncogenes. Proto-oncogenes are genes that we all have them, but if they get mutated, they can lead to different pathways that can cause them to become an oncogene. So it makes you more prone to potentially getting that type of cancer. Now, an oncogene is when a proto-oncogene has been mutated. When it's been mutated, it now becomes overactive and a tumor starts to form. We also see that there's another type of gene that's super important. It's called the tumor suppressor gene. These genes inhibit cell proliferation, and so when we look at it, cells are going to have certain control mechanisms that determine whether or not they're going to grow and divide. And if that cell notices that there's no space or that there's not enough nutrients or things like that, it's not going to grow, and the tumor suppressor gene will turn that off. However, in the case of cancer, this gene gets mutated and it won't turn the cell off, and so the cell just keeps dividing and growing and keeps dividing and growing, which causes that tumor even if there's no more room in the area and even if nutrients are low. And so if you take a look here, this is just showing you a picture that shows you that the cell has normal DNA, but as carcinogens come in, it can react with the DNA, which causes it to mutate. This mutation is a precancerous cell, but if more and more chemicals or things come in and promote it to change more, we see the mutation in the DNA gets greater, and now we actually see the progression into cancer. All right, and so this is like what the progression looks like in a picture of having, of course, the initiation, the promotion, and the progression. So now let's talk a little bit about benign versus malignant growth. All right, so we're going to look at malignant tumors first. Now, malignant tumors can kill a host if they're left untreated. All right, and so this is the kind that can be very deadly if it's left untreated. It's confirmed to be malignant if it is invading in other tissues. This means it has metastasized or it's spreading to other areas. Tissue-specific differentiation does not happen, and so what we look at this is when we take a biopsy of those cells, those cancer cells, they do not resemble the original cell very well. So if they came from the liver, they don't really look like liver cells. So the greater degree that they look different, the more aggressive that cancer is considered. We also see that it grows very rapidly. It may initiate tumor vessel growth. This is called angiogenesis. This is where the tumor actually causes blood vessels to start growing in it. This provides it with more nutrients so that it can actually outcompete the healthy cells, and it can grow faster, and it makes it a lot harder to remove because now the tumor is vascular, making it where if you try to remove it, bleeding could be a big factor. We also see that it frequently can cause necrotic tissue to form because it is siphoning off blood vessels and resources from the good tissue, and these cells are dysfunctional, meaning that it's going to cause the organ to not be able to function at its proper capacity or even do its job altogether. When you look at a benign tumor is different. It does not have potential to kill the host, but it could be life-threatening depending on its location. And so if a benign tumor is in the brain and it starts to grow and put pressure on other parts of the brain, it could potentially be life-threatening, but the actual tumor is not spreading in order to cause the destruction. It's just putting pressure on the good tissue. This type of tumor does not invade adjacent tissues. It does not spread to distant sites. And so it's going to be a lot of times what we call encapsulated. It's inside of kind of a capsule, like when you have medicine that's inside a capsule. It's contained. It's more closely going to resemble its original tissue type. So again, if we take a biopsy, it's going to look a lot more like where it came from. Like if it came from the liver, it does still look like liver cells. And sometimes they actually still retain some of their function. They're just not doing as good of a job. They grow a lot more slowly. These guys have a little vascularity, meaning they're not making blood vessels grow into them. And so again, they're easier to remove. And because of this, they rarely have necrotic tissue with it. So in your textbook, you have a comparison in table 1.2 between benign tumors and malignant tumors. You'll notice that these are pretty much opposites. All right. You do need to be able to differentiate between benign and malignant, because I may ask a question that says, which type of tumor remains localized? Well, you would pick benign. If I said which type of tumor has rapid growth, you would say malignant. And so when we look at this, you need to make sure you look at this chart and know the characteristics. Also down here at the bottom, it shows you a picture. The benign tumor is encapsulated. It does grow and start pushing on tissues around it, but all the cells are contained. Whereas in a malignant tumor, it normally has an irregular shape. It starts to invade with like finger-like extensions into other tissues, and blood vessels start to form as well in these structures. All right, so another thing we want to look at here is some terminology. When you have oma at the end as a suffix of a word, this normally is going to indicate a benign tumor. So an adenoma means that it's a benign tumor. If you have carcinoma or sarcoma, it indicates more of a malignant tumor. So when you have carcinoma, it's an epithelial origin. So you have an adenocarcinoma. If it's a sarcoma, it has what we call a mesenchymal type of origin, meaning more nerve, bone, or muscle origin. And then leukemias are going to be like a white blood cell origin. There are some exceptions to this rule, just like in English where they have that exception of I before E. We have an exception here as well. A lymphoma, hepatomas, and melanomas, they are still malignant. And so this is where that oma, which normally tells us it's benign, is not the case for these three types. These are exceptions to the rule. Now also, if you look here, this shows you kind of a timeline or progression of what starts to happen when cancer is spreading. It's going through that process of metastasizing. So cancer cells will secrete enzymes and motility factors. The basement membrane in the blood vessels is disrupted. Cancer cells will then escape into the circulation. Once they gain access either into the lymph vessels or the blood vessels, they can pretty much travel anywhere they want. This gives them a highway to go pretty much anywhere in the body. Undetected cells move out of the blood. Once they've moved out of the blood, they can then potentially start to grow in a new area. Once they target a site that they would like to grow in that new site, they start to invade it and they form a new tumor. And this is what can happen when we start to see that people have multiple tumors in their whole body, but it started out as maybe liver cancer, but now they have a tumor in their kidney as well as their stomach or different areas like that. It means that it's metastasized, it's spread through the blood or lymph system, and it's gained access to other organs. This particular chart, table 1.3, just shows you some common sites of metastasis. So it's saying like bladder cancer a lot of times can move into the bones, liver, and lungs. Breast cancer can move to the bone, brain, liver, and lungs. And so this is just giving you an idea of how it spreads and what it will normally spread to if it's given the chance. It could spread to other sites as well. This is just showing you that these are the main ones that we do see. All right, so what are some clinical manifestations of cancer? How can a person kind of see or tell if they may have cancer present? It's hard because sometimes we don't actually see the issues until cancer is actually more widespread or it's causing major issues in the body. However, we can use the word caution to look at this. So first is watch for changes in the bowel or bladder habits. If your bowel or bladder habits change greatly, it might be a red flag that something is going on. If a sore does not heal, it constantly is opening, it's never really healing, that could potentially be an issue. Unusual bleeding or discharge. Unusual bleeding or discharge could let us know, again, that something's happening, especially if it's the urinary system, the reproductive system in males or females. Other things could happen besides cancer, but anytime you have unusual bleeding in an area, it could be an indication. Thickening or a lump in the breast or elsewhere. And so the breast is one of those that we are taught as women to check ourselves for and look for those lumps. However, these lumps could be anywhere else in the body as well if cancers in another area. Indigestion or difficulty swallowing could be an indication that something's happening in the chest or throat region. Obvious change in a wart or a mole, this is going to be a precursor or an indication that skin cancer is present. And then also a nagging cough or hoarseness. If that just never really goes away, you need to get that checked out. And so these are just some of those things that could be what we need to be cautious about and be watching in individuals to see if cancer might be present. Now in children, we see the warning signs are a little bit different. When we see cancer in children, we would use children as the acronym here. Continued unexplained weight loss. Kids are supposed to make milestones and be gaining weight, and so because of that, that could be a complication or an issue. Headaches with vomiting in the morning. Increased swelling or persistent pain in their bones or joints. Because kids should not be having that kind of pain. As adults, we get arthritis and things like that, and it's different. A lump or mass in their abdomen, neck, or even elsewhere. Development of a whitish appearance in their pupil, because your pupil is supposed to be dark. If it has a whitish appearance, that's sometimes a precursor to a potential kind of cancer in the eye. Reoccurrent fevers not caused by infection. They can't find that they have any kind of infection, but they keep having fevers. Excessive bleeding or bruising, and noticeable paleness or prolonged tiredness. And again, kids will get tired. Kids may appear pale, but if this is persistent, it's a longer term, this is an issue. All right, so these are some warning signs potentially in children. Now, once a person is diagnosed with cancer and they begin potentially treatment, or if they decide to not have treatment, there are some complications that can come into play. A cancer patient could easily become anemic, meaning that their red blood cell count starts to go down, causing them to not be able to carry oxygen as efficiently. This causes them to be tired. We also see cachexia. This is known as wasting. The body starts to almost waste away because the appetite starts to decrease. They don't eat as much. They're tired. They're lethargic. And so because of that, the body starts to kind of waste away. We see that they could have fatigue, infections. Again, if their immune system is down due to fighting the cancer and also any kind of treatment that comes along, other infections could take the opportunity. Leukopenia, this means their white blood cell count can decrease. Thrombocytopenia means that their platelet count will decrease, which means that blood clotting won't happen as easily, and they also could have very large increases in pain. So how do we diagnose cancer? We would do a biopsy. It can be done through needle aspiration, where they could just take a needle and take a small piece of the tissue. They may have to do an endoscopy where they have to go in a little bit more, like with a camera down the throat, or they may have to also go up through the rectum or something like that. Laparoscopy is they would still use the camera but with small incisions, or they may have to actually excise out the issue and then do tests on it. They also could do some blood work. These would look for tumor markers. This is going to be where they're going to look for antigens on the surface of tumor cells. And so if there's antigens on the tumor cells, then your immune system should have picked up on that. So they can use these tumor markings for screening. They could use them for diagnosis, monitoring to see if your tumor markers are going up or down based on your treatment. This could determine what kind of treatment you might need. And then also this is what helps them establish if the patient is in remission. If their tumor markers are low or non-existent, we would say that the patient is in remission. There are miscellaneous procedures depending on what type of cancer might be suspected. They may use things like x-rays, radioactive isotope scanning, CT scans, endoscopies, ultrasounds, MRIs, PET scans. So they may use multiple ways to help diagnose and may find locations of tumors and also see if they would even be able to be potentially removed. Now, once they gain more information through these scans and through the different tests, this will allow them to do some grading and staging of the tumors. When they're looking at grading, this is going to look at the histological characteristics of the tumor cells. So this is going to look at the tissue. How does the cell compare to its tissue of origin? There's 3 to 4 classes in this, where they may call it class 1, class 2, class 3, and maybe even class 4. Staging is actually more useful, and staging is normally what we discuss when people say, well, I'm in stage 3 cancer, I have stage 4 cancer. When we look at staging, they're going to look at the location and pattern of spread within the host. Has it moved? Is it spreading to other areas? Where did it begin at? It will also look at tumor size, whether it will look at the original tumors as well as new tumors. tumors, the extent of local growth, how quickly is it growing in that region? Is it very rapid or is it a little slower? Are lymph nodes involved? Lymph nodes are going to be part of that lymphatic system where they could use the highway to get to other areas. And so if lymph nodes are involved, this could tell you that new tumors could start to appear in other areas as well. And then they're going to say, well, now that the lymph nodes are involved, is there distant metastasis? Meaning, did it spread? Did it start in the liver and now we have lesions in the kidney? Did it start in the liver? Now do we have lesions in the brain? It's going to allow us to look at those. When they do this staging, they usually use the TNM system. It's one of the most widely used systems. The T stands for the tumor, so they're going to evaluate the tumor first. The N looks for the lymph node involvements, and the M is the metastasis. So it's looking at all three factors, and that's going to help us know what stage it's in. Guys, the higher the stage, the more the cancer has spread and the harder it's going to be to treat. Results of staging help us determine what kind of treatment needs to be given. If they're in stage 4 and it's pretty much very widespread, then treatment might not be a good option for them. But if they're in stage 1, it could be where we could put them in remission relatively quickly based on what treatment is chosen. So what kind of treatments? Well, when we're looking at treatments, guys, we have 3 goals in mind. The first is curative, in the sense we want to try to cure them. And we don't always tell people they're cure of cancer, but we do tell them they're at least in remission, because there is a chance the cancer potentially could come back. The next one is palliative. This is going to give the best quality of life as possible. So with this, it's like making them comfortable, giving them as much time as possible that we can based on the treatment. And then the prophylactic is going to be more preventative treatment. These are going to be things that we want to prevent it from coming back, or we want to prevent you from developing something else. Some of these treatments include surgery. Surgery could be the option to remove tumors. Radiation, okay, might be an option. Chemotherapy is the use of drugs to treat the cancer. They may use hormone or anti-hormone therapy. If they find that a tumor is hormone dependent, we want to remove that hormone so that it will slow its growth. If we find that another hormone can actually hurt its growth, then we might use that. And the last one is biotherapy. Biotherapy is using immunotherapy and biological responses to help fight the invader. This is to help modify and change the person's immune towards the cancer. Our body fights invaders, and cancer is technically an invader because it no longer is doing what it should do for the body. And normally your immune system does pick up on cancer cells and tries to kill them if at all possible. Biotherapy is trying to enhance that process so that your immune system can help take care of those cancer cells quicker and more efficiently. I have a couple of questions related to cancer that I want to ask. So following a shift report on an oncology unit, so you're working on in the oncology unit, which patient would the nurse assess first? Which one should you see first? Should you see the 47-year-old male diagnosed with prostatic cancer admitted for chemotherapy? Should you see the 89-year-old female diagnosed with metastatic breast cancer complaining of pain out of 7 out of 10? The 68-year-old male diagnosed with late-stage lung cancer complaining of difficulty breathing, or D, the 57-year-old female diagnosed with cervical cancer admitted for radiation. So you need to take a close look at these. They all have types of cancer, okay? But if you look at A and D, they are both there to receive certain kinds of treatments. They're not complaining of any kind of complication at this time. All right, and so you would not need to see A or D first. Now that brings us to B and C. In B, she has a very high pain level here in B. This could be a big complication and we would want to maybe look at it. But guys, C is the best answer because this patient is having difficulty breathing. Anytime a patient is having difficulty breathing, they need to be seen first. We have to make sure that airways and breathing is established in order to make sure that the person potentially survives. So anytime you see that there's difficulty breathing, you need to make sure that you pick that answer. So in this case, C is the best answer. In our next question, which of the following assessment findings is most concerning to the nurse and will require immediate action? All right, so A is we have a 5 millimeter bluish black mole with asymmetrical edges. B is multiple raised flesh tone skin lesions on a patient diagnosed with neurofibromatosis. C, a patient complaining of fatigue after receiving chemotherapy. Or D, a simian crease in a patient diagnosed with Down syndrome. Now this question would probably actually be better for me to show you after the genetic video. However, guys, if we're looking at the raised flesh toned skin lesions in neurofibromatosis, we need to watch them, but it's not immediate. They don't need immediate attention. The simian crease in a patient diagnosed with Down syndrome is not an issue. It just means they have one crease in their palm. All right, it sounds like it's more important than it is, but it's really not. So A and C are what we need to look at. The patient complaining of fatigue after receiving chemotherapy, this is pretty normal. However, you would still need to watch the patient. But A, guys, is what is needing to be taken care of immediately. It's 5 millimeters. It's different in color, meaning it's already blackish blue, and it has asymmetrical edges, meaning that's not that it has rough edges to it. And so this needs to be looked at immediately. So you would pick out of all these options, A would be the one that you would pick. And I put that here because this is dealing more with the cancer side. All right, so this completes the section about cancer that we're going to discuss here. We will talk more specifically about different types of cancer when we get to those sections, like bone cancer or whether it's skin cancer and things like that. But this at least gives you an overview when we're looking at new growth in the form of cancer.